Hello everybody, and welcome to this CyberMD lecture, which will cover peptides and receptors with regards to the cardiovascular system and the USMLE Step 1 exam. Please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education content and resources to students around the world. Let's start by discussing atrial natriuretic peptide, or ANP, which is a hormone secreted by the cardiac atria, specifically the myocytes, in response to increased blood volume and a subsequent increase in atrial pressure. ANP acts as a vasodilator at the renal tubule, promoting the excretion of sodium and water in the kidneys, leading to a reduction in blood volume as well as blood pressure. ANP binds to its receptor, the natriuretic peptide receptor A, or NPRA, which is a membrane-bound guanylate cyclase, leading to the production of cyclic guanosine monophosphate, or cGMP. That causes the vasodilation. The dilation will occur at the afferent renal arterioles, while the constriction will occur at efferent arterioles. I know I haven't mentioned constriction thus far, but as you'll see in the diagram, we're going to dilate the afferent and constrict the efferent, and this is how the increase in filtration of water and sodium occurs in part. B-type, or brain natriuretic peptide, often called BNP, is another hormone produced in the heart. However, it is produced by the ventricular myocytes of the heart and also in response to increased volumes and subsequent increased pressures. BNP also acts as a vasodilator and also increases the excretion of sodium and water in the kidneys. BNP binds to the natriuretic peptide receptor A, leading to the production of cyclic GMP. BNP, however, has a longer half-life than ANP and is a blood test that is often used to help in the diagnosis of heart failure. When used in this manner, it has a negative predictive value that is considered good for clinical practice. Now, let's talk about chemoreceptors. Chemoreceptors are sensory receptors that detect changes in the concentration of chemicals such as oxygen and carbon dioxide in the blood. There are two types of chemoreceptors: peripheral chemoreceptors and central chemoreceptors. Peripheral chemoreceptors are located in the carotid bodies and aortic bodies, which are clusters of cells in the carotid sinus and the aortic arch, respectively. It's important to note that the peripheral chemoreceptor bodies are actually stimulated by an increase in carbon dioxide within the blood, a decrease in the pH of the blood, or decreases in oxygen below around 60 millimeters of mercury within the blood. The central chemoreceptors, located in the brain, specifically the medulla, are going to be affected by changes in the pH and carbon dioxide content of the interstitial fluid of the brain. These do not directly respond to changes in oxygen levels. I repeat, the central chemoreceptors do not directly respond to changes in the oxygen content in the blood. Now, let's discuss a few extracardiac pressure receptors, also known as baroreceptors. Baroreceptors are sensory receptors that detect changes in blood pressure. There are baroreceptors in the aortic arch and carotid sinus that are innervated by the vagus nerve and glossopharyngeal nerve, respectively. Because both of these nerves have parasympathetic properties, when blood pressure increases, the baroreceptors are stretched, leading to increased firing of action potentials that activate the parasympathetic nervous system and inhibit the sympathetic nervous system, resulting in a decrease in heart rate and blood pressure. When blood pressure decreases, the opposite happens, leading to an increase in heart rate and blood pressure. These signals are transmitted to the solitary nucleus of the medulla. Hypotension, or low blood pressure, can be caused by various factors, such as dehydration, bleeding, heart failure, or anaphylaxis. In hypotension, there is a decrease in arterial pressure, which means decreased stretch and decreased afferent firing from the baroreceptors. The lack of parasympathetic signaling means that an increase in the efferent sympathetic signaling will occur. This increase in sympathetic signaling results in increases in heart rate, vasoconstriction with subsequent elevations in blood pressure, increased cardiac contractility, and a subsequent compensatory increase in blood pressure. These mechanisms are important compensatory changes, especially in the setting of hypovolemic, which means low blood volume, shock. A notable phenomenon that occurs with baroreceptors is the carotid massage. The increased pressure causes increased firing of the parasympathetic glossopharyngeal nerve, resulting in parasympathetic effects, such as a decreased heart rate, vasodilation, and decreased cardiac output. Massaging of the carotids, or activities that cause similar effects, such as tight neckties in males, may cause symptoms such as lightheadedness or syncope secondary to the decrease in cardiac output. A third important physiologic phenomenon surrounding the baroreceptors is known as the Cushing reflex. Cushing's reflex is a physiological response to increased intracranial pressure, which can be caused by head trauma, bleeding, or a brain tumor. When intracranial pressure increases, it can compress the brainstem and affect the respiratory and cardiovascular centers. Cushing's reflex is characterized by an increase in blood pressure, a decrease in heart rate, and irregular breathing that all occur in the setting of elevated intracranial pressure. The increased intracranial pressure puts pressure on the arterioles, constricting them and causing ischemia to the neural tissue. Increases in carbon dioxide due to this ischemia and a subsequent decrease in pH levels will ultimately cause an increase in sympathetic drive as the body is trying to increase blood pressure to maintain perfusion to the brain tissue. This high blood pressure in the body, however, results in a reflex bradycardia from the baroreceptors in the carotid sinus and aortic arch. In summary, peptides such as ANP and BMP can activate specific receptors in the body, leading to physiologic responses such as vasodilation and increased urine output. Chemoreceptors and baroreceptors play crucial roles in maintaining homeostasis by detecting changes in chemical and pressure levels and triggering appropriate responses. Hypotension and the body's compensation for it, carotid massage, and Cushing's reflex are all physiologic phenomena that are relevant to the baroreceptors in the body. Understanding the roles of these peptides and receptors in the body and the mechanisms that regulate blood pressure and breathing rate are important for medical students in preparing for the USMLE STEP 1 exam. By studying these topics in depth, you should get a better understanding of how the body functions and how to diagnose and treat conditions that affect cardiovascular and respiratory function. Thanks for tuning in, and we hope that this lecture helped.